Do you find that when people are diagnosed, okay, you have this type of depression, here's some medications to help you get to that level spot where you can now, I think you said, think differently, therefore act differently. Should that be coupled with some type of counseling or coaching? Otherwise, I would think in my head, if the person fell down the depressive, like sort of into this depressive state, yes, the medication could help them feel better for a while, but without the proper maybe counseling, therapy, what I don't know the right words, they could potentially fall back down there or just stay on medication for a way longer time than they would need, right? Shouldn't it be used more as an aid rather than like a vitamin, like that you just keep using forever? You know what I mean?
You're actually sharing the age-old issue that currently has existed for the past 25 years.
Okay.
And the issue is, can mental health be treated with medication alone? Or can mental health be treated with talk therapy alone? Or is there some combination of the two?
Yeah.
Now, I'm of the school of thought that says talk therapy is more important than medication. I believe if I can get someone to understand what the dynamics are that are going on within them, that are historical as well as current, that they can learn how to shift who they are based on what's inside of them rather than absolutely having to have a medication. Now, there are some individuals in terms of major depressive disorders who actually need the medication to create an even keel for them to be able to address issues. However, I'm not one who believes that people need to be on medication forever. I am one who believes that they need to be in the therapeutic process with a clinician, either a clinical psychologist, an organizational psychologist in terms of executive coaching, a marriage and family therapist, a licensed clinical social worker, an LPC, licensed professional counselor, to address those types of issues that exist for them. And I don't necessarily believe that medication is the end all to everything.
I've been of that thought for a long time.
I'd probably get in trouble if I said, insurance companies look at the best way to treat and at the same time make a profit and reduce their costs.
That's good.
And so the reality is, if an insurance company can treat you by medication, that's cheaper for them than treating you by psychotherapy.
Sure.
So they would prefer for somebody to be treated by the medication rather than by the talk therapy or some combination of the two, because then the insurance company has to pay for both the therapy as well as the medication. But the insurance company doesn't like to do that. They like to pay for one or the other.
But the medication may not actually be treating them. It just may be a temporary treatment.
Absolutely. And it could be a masking effect, or it could be an actual helping effect. And it depends on the individual and their psychological makeup and what they've experienced in their lives. So I'm not one who is a big fan of medication if I can do as much as possible in a psychotherapeutic venue rather than with the medication itself.